often men will find it difficult to discuss problems such as mental health problems and problems related to their sexual health. So why this is relevant in diabetes is that we know that for people with diabetes, they're twice as likely to develop major depression compared to people who don't have diabetes. So it's a real problem. What we also know is that only a third of people who have major depression are actually identified and treated. So 2/3 go untreated. And there are a number of reasons for this. I think the most common reasons are that people think that depression is secondary to their diabetes, so they automatically think, well, if I've got diabetes, it's no wonder I'm feeling pretty ordinary. But in fact, diabetes and depression are separate illnesses, so they require separate treatments. I think the other mistake people make is that they think that if they are feeling pretty flat, maybe they're even depressed, that won't impact on their diabetes. But we know that people with depression, their blood glucose levels are usually higher, their self-care is usually poorer, and they're 3 times more likely to develop complications. So depression can have a massive impact on diabetes and its long-term outcome. The other reason that only a third of people with depression are identified is because men in particular often see depression and anxiety as weaknesses rather than as an illness, and so therefore they're reluctant to go and talk to their doctor about it and seek treatment. So if a man with diabetes has other problems, such as difficulty getting to sleep, or if they get to sleep they may have trouble staying asleep, they may wake up during the middle of the night and not be able to get to sleep. If they're perhaps drinking more than normal, to help themselves to feel better, if they've lost interest in things that once brought them pleasure, or if their appetites change, they may be eating more, they may be eating less. Well, these could be signs of depression. So it's worthwhile going to your doctor and having a chat and having a proper assessment, because we know that treatment for depression works.